We have had several people who have had C-Diff. What is C-Diff? What do you think it is? It's a bacteria that grows in the intestines only, and it's actually related to tetanus. C-Diff is a bacteria that grows in the gut. Who is most likely to get C-Diff?
People on antibiotics.
People who are on antibiotics. Do you know why?
Breaks down the good.
Right, it kills the good bacteria, and antibiotics kill the good bacteria and allow the bad bacteria to continue. And C-Diff grows on that bad bacteria. What's one of the first symptoms of C-Diff?
Diarrhea.
Diarrhea, exactly. And this is important for nurses as well as CNAs. If they are not having diarrhea, don't get a stool specimen because they don't have C-Diff. So there are a lot of carriers out there. They do not treat carriers because carriers may have it forever. We had a physical therapist, actually one of our occupational therapists was our physical therapist and was our occupational therapist, and both of them got C-Diff at a different time. Was out for almost 3 months. He was actually put in the hospital for IVs because he was so dehydrated from it. And he was a very thin man, and he just didn't have any extra going for him, so he had to have IV therapy to rehydrate him and to get rid of the C-Diff for him. He wasn't working here when she got it, but she was very ill with it also. So C-Diff is a bacterial, Clostridium difficile is what it stands for. When we have somebody with C-Diff, has everyone here taken care of somebody with C-Diff? What did you do when you took care of them?
Wash your hands.
Yeah, wore gloves.
Wore gloves.
For sure.
Wore gowns.
And bagged everything.
Exactly. Okay. One of these little happy things should have been on the door, and we're not using this enough. Nurses, take note of this, please.
Okay.
If you have somebody with C-Diff and they have to have diarrhea, otherwise they don't have C-Diff.
Right.
This needs to be on the outside door to remind us of several things. You can tell me what this is.
Melt away bag.
Melt away bags. What do we use them for?
Put their clothes in.
Put their clothes in, their sheets, their blankets, their towels. When we have C-Diff, what do we do with the diapers?
They go in the biohazard bags.
Biohazard bag, exactly. And that goes in, we have a biohazard. And what do you do with the biohazard bags?
They go in the biohazard room and
Exactly.
back in the box.
In the dirty laundry room, if y'all don't know where it's at, a dirty utility room. The dirty utility room. In that back room, there is a container. We actually need some smaller bags. These are kind of big for that. Okay, so I heard somebody say masks, but that is not appropriate for C-Diff. C-Diff, the only things that you have to have are a gown. Before you walk in that room, put a gown on, and you put these on. If you don't know, I'm going to demonstrate. You will put it on backwards like this and tie it in the back. I remember somebody used to work here and they always put it on the front and tied it across the front. But they were skinny, it didn't make any difference. But if you're heavy like me, it's not going to cover your front. So you have to put it on backwards and tie it. And actually that's the way that you wear it. That is the correct way to wear it. So the reason you do is once you wear it, you will see that and then the other thing that you wear will be gloves. And you will put your gloves on. And you will tie this, of course, and you will go into the room with your gloves on. Before you leave that room, you are going to remember everything your gloves touch. You've changed them. You've put their laundry in the disposable bag. You've put the biohazard in this. Now, how are you going to get out to your buckets to put them in it? Are you going to go open the door with your gown and your gloves on that you've just changed that resident? No. So what you will do is you will carefully take this so that you're not touching anywhere, leave your gloves on, and remove your gown and turn it inside out and wipe these off, and the gloves will be inside and all the soil is inside this, okay? You will throw it in the trash or you can put it in the biohazard. You don't need to because it shouldn't be soil unless you got poop all over the front of you. If you do, it goes in the biohazard. Other than that, you would put it in the garbage. Then what do you do next?
Wash your hands.
Wash your hands. Hey, great, y'all remembered. You're going to wash your hands, and from that point, you can go open the door, Put some more gloves on, because you're not going to pick up this bag and this bag with your bare hands, are you? So you're going to you could put just one on if you can carry both bags. Open the trash, open it, drop it in, pull your glove off, throw it away. Wash your hands again. Okay? So those are the steps. You do not need masks, you don't need hoods, you don't need goggles. Unless they're yeah, I've had a couple that had a lot of gas with the diarrhea, and you're standing there trying to clean them and they're pooting and it's runny. You might want goggles in. Okay, that's it. So the healthcare workers should always, before they go in that room, put a gown on and put gloves on. Now, what do nurses do when they go in to give their medicines?
I have gown and gloves on for that too, for sure.
And I'll tell you why. Because C-Diff can go everywhere. It can be, you can be changing the bed, not thinking, touch the handrails. It could be as innocent as a housekeeper cleaning in there and taking their dirty glove and holding on the handrail while they're down cleaning under the bed. It can be another employee that hasn't had this training, and they go over and they open the door with their dirty gloves on and go out and take the trash out. So you're exposing yourself every time that you touch that door handle with hands.
Is the person in the room not exposed to it now either?
Is not what?
The person that they're sharing the room with is exposed to it also, right?
If there's to some degree, they also have to have a dedicated potty, a bedside commode. Whoever has C-Diff should never ever be using that toilet unless they're the only one using it. I would think, say she had C-Diff. He doesn't use the bathroom, he doesn't use the bathroom, doesn't use the bathroom. So it would be okay to let use that bathroom. Just make sure that housekeeping knows to really clean that bathroom well. And when they go in, they should have gown and gloves on also. Anybody that walks through that door with C-Diff should have a gown and gloves on. Okay? Everything in that room is considered contaminated until they stop having diarrhea. When the diarrhea stops, they're done. The nurse can take this down. You'd want to talk to your infection control person. Okay, for the nurses, we have a dedicated stethoscope, doesn't look like much, and a blood pressure. Something's missing there, isn't it?
Yeah.
But at least leave this at the bedside, okay? If they're a diabetic and you're doing blood sugars, how would you handle that?
Wipe it before and after you.
Still it's okay to take it with the
With
machine.
the sandy wipe or the bleach wipes.
Exactly. Bleach kills C-Diff. Something that has come out recently is that hand sanitizer does not kill C-Diff. So it's safer to wash your hands with soap and water if you have a patient that you have C-Diff. Much safer than using the hand sanitizer. Okay? So always suspect C-Diff if they've got diarrhea. Always. Always maintain the contact precautions until it's over. Nurses, this is especially important for you. Monitor visitors. They should wear gloves and gown when they go in also, because they could be taking it home to their family. So you'll have to remind them. Age, you'll have to remind them. Family members, if there's somebody with C-Diff.